100 million people are saddled with healthcare debt in the U.S. That includes about 40% of all adults, according to an investigation by Kaiser Health News and NPR.
America, according to a Kaiser Family Foundation poll, 25% of adults with medical debt owe more than $5.
Although the world's wealthiest country with a GDP of around $25 trillion, half of its population has medical debts. It's an unresolved issue, and the matter gets more severe every year. Considering rising inflation and interest rates, households have to go through bankruptcy to cover medical expenses. In 2021, according to Debt.com, a company that teaches people about managing their finances, half of all Americans currently had medical debt. This is an increase from 46% in the previous year. Additionally, over half of the Americans who have medical debt owe about $1,000 or more. So in this video, we'll talk about a medical debt crisis in America and uncover the fascinating facts about why ordinary citizens in the U.S. cannot pay their medical bills. But before doing so, consider subscribing to the channel. That way you are supporting the production of future episodes. It's not a secret that public health is one of the most expensive sectors. As a result, governments around the world spend a substantial part of the country's budget to cover the medical expenses of their citizens. America is not an exception. According to the American Medical Association, the amount of money the U.S. spent on health care went up by 2.7% in 2021, reaching a total of $4.3 trillion U.S. dollars, which is about $12,914 per person. However, this growth rate is much lower than the increase seen in 2020. This slowdown is because the government spent less on pandemic-related health care, but more people used medical services that they had put off during 2020. As a result, as a percentage of the economy, health care spending was slightly lower in 2021 compared to 2020. A recent survey has revealed that 1 out of every 4 Americans has a medical debt of $10,000 or more. This is surprising because half of them have health insurance, which is supposed to help them avoid paying too much for medical care. Almost half of the people who participated in a survey and have medical debt said the main reason for their debt was going to the emergency room. A little more than 30% of those surveyed also said they incurred debt during the pandemic, while 23% said it was because of mental health treatment. The survey was conducted by Affordable Health Insurance and asked 1,250 Americans. According to Health System Tracker, despite over 90% of the United States population having some form of health insurance, medical debt remains a persistent problem. For people and families with limited assets, even a relatively small, unexpected medical expense can be unaffordable. For people with significant medical needs, medical debt can build up over time. People living with cancer, for example, have higher levels of debts than individuals who have never had cancer. Regarding insurance, the picture is the following. In 2021, according to Congressional Research Service, about 327 million people were living in the United States. The majority of them either had health insurance that they paid for themselves or were covered by a government program like Medicare or Medicaid. However, there were still about 8.6% of people who didn't have health insurance. For the same year, the typical expense for health care per person in the U.S. was about $12,300, which is a lot more compared to Germany, where it was only $7,400 or 40% lower. Despite this, the U.S. is not doing as well as other countries when it comes to how long people live and how many individuals have health insurance. Furthermore, CNBC highlighted a severe problem. Over half of Americans have medical debt, even those with health insurance. The Kaiser Family Foundation conducted a study and found that approximately 41% of individuals, around 100 million adults, have debt related to medical and/or dental expenses. The amount of debt varies among individuals, with 16% having debt less than $500 and 12% having debt of $10,000 or more. Of those with medical and/or dental debt, 56% owe less than $2,500, 44% owe $2,500 or more. In addition, over 50% of the people surveyed said they have unpaid medical bills, stopping them from achieving their financial objectives. Specifically, almost half of those people said they couldn't purchase a house or save for retirement because of their medical debt. The severity of the issue should not be underestimated. Medical bankruptcy is one of the most significant problems for ordinary Americans. A new study from academic researchers found that 66.5% of all bankruptcies were tied to medical issues, either because of high cost for care or time out of work. An estimated 530,000 families turn to bankruptcy each year because of medical issues and bills, according to the research. The Commonwealth Fund reiterates that the U.S. spends more on health care than any other developed country, but that does not mean it's the best. Americans are living shorter, less healthy lives because our health system is not working as well as it could, according to the report's lead author, Marina Guna, Senior Research for the Commonwealth Fund's International Program in Health Policy and Practice Innovation. To catch up with other high-income countries, the administration and Congress would have to expand access to health care, act aggressively to control costs, and invest in health equity and social services we know that can lead to a healthier population. One of the most shocking problems in American healthcare is that an ambulance may cost more than medical treatment in Europe. Last year, Fair Health reported that private insurers' average payment for those rides jumped by 56% between 2017 and 2020, from $486 to $758. Also, ambulance operators' sticker prices, before accounting for discounts negotiated with insurers, have risen over 22% in the same period and are now over $1,200. Such an expense can be devastating for low-income families. For example, 45% of single-person non-elderly households could not pay over $2,000 from current liquid assets, and 63% could not pay over $6,000. Lower-income households are much less likely to have the liquid assets to meet typical cost sharing. However, the question is why healthcare is so expensive in the U.S. Although there are no simple answers, here are the main ones. The proportion of people in the U.S. aged 65 or older has increased significantly in recent years, from 13% in 2010 to 16% in 2021. This number is predicted to keep rising and reach 20% by 2030. Since older people usually spend more money on healthcare than younger people, the increasing number of elderly Americans will cause healthcare costs to rise in the future. In addition, the number of people enrolled in Medicare is expected to increase significantly, reaching 65 million in 2022. This enrollment growth is likely to make Medicare more expensive. The government agency that looks at the budget thinks that Medicare spending will become twice as much over the next 30 years compared to how much the country makes. This means that Medicare will cost 5.9% of the economy by 2052, compared to 2.9% in 2022. Healthcare costs in the U.S. are affected by the prices charged for medical services, and these prices tend to increase at a faster rate than the prices of other things people buy. For example, over the past 2 decades, the average cost of everyday goods and services has gone up by 2.4% each year, while the cost of medical care has gone up by 3.4% per year on average. However, there's more. Childbirth and drugs cost significantly more in the U.S. than in other countries. Giving birth costs $18,865 on average, including pregnancy, delivery, and postpartum care, according to the experts. Tennessee, Texas, Utah, and Alaska are among the states with the most expensive childbirth expenses in the country. With regard to drugs, people in the United States pay more for their medicine compared to other countries when you look at the amount spent per person. To figure out how much more expensive medication is in the U.S., we need to take into account the types and quantities of drugs used. However, research by the RAND Corporation has found that U.S. prescription drug prices surpass those in 32 other countries by around 150% on average. U.S. patients are even paying triple the price for prescription drugs such as in Korea, Portugal, or in Australia, and 3.5 times as much as Slovakians, Greeks, and residents of some of the Baltic countries. With unoptimistic forecasts, like the inevitable rise of healthcare expenditures in the upcoming years, average Americans have to be prepared for the worst, considering rising inflation with the banking crisis and credit card debt. Thank you for watching. Hit the like button if you enjoyed the video, and feel free to share your opinion on the subject in the comments section below. Your opinion is always appreciated.